and then I'm going to talk more about tongue tie and lip tie. And then because Dr. Irene has basically gone through a lot of the anatomy stuff, so maybe I'll focus more on how I would do the assessment, and which is going to be very easy because something that you could, as a professional or even as a parent, that you could also very easily do it at home. So something about myself, I was born in Hong Kong from a very local Chinese family. I also went to school here, a local school, until high school. Then after that, for college and postgraduate, I went to San Francisco for graduate and postgraduate degree, where I also earned my CCC-SLP as a speech and language pathologist. And then because throughout my career, that actually there were times that I couldn't quite fix the tongue. So I got really interested in how to fix the tongue, especially the tongue thrust. So that's when I got the information about the AOMT, which is the Academy of Orofacial Myofunctional Therapy. And then I actually went there and then studied their course and got less cert. And I got very interested in the field even more. And I also got a lot of training in oral motor and oral placement disorder. And currently I work at private clinics and also some elderly homes. So because of my growing up and also my educational background. So hopefully I can talk about lip tie and tongue tie from a more different cultural background kind of perspective. Dr. Irene has talked about what is lip tie. So basically there's a little connective tissue that connects the upper lip and the gum. And then when that becomes too thick, too short, too stiff, basically is hindering the lip movement, then we might have to consider removing it. But how I would look at it is that whether it is truly affecting the normal labial, the lip functions. Like for example, can you close your lip properly without any tensions? So if you have to close your lips, like really forcing them to close, then that means that there is a tension on your upper lip. And Dr. Irene has talked about the gummy smile. And then because of the gummy smile and also because of unable to close the lip properly, very likely you'll be breathing through your mouth. And then now we all know that breathing through the mouth can cause a lot of other health issues as well. For example, dental hygiene problem, you're going to have odor in your mouth, tartar in your incisors or even the back teeth. And then that might also contribute to the sleep problem, and especially when you're breathing in your sleeping too. And then, for example, babies, even in older children, it might interfere with eating and drinking because, again, we have to use our lips to drink and also to latch, and without that proper lip closure, which is going to be very difficult. So in the end, that you might have to use your teeth a lot, which is not going to be very helpful for the lip development and also the dental development. And of course, when you have the gummy smile, and also when the lip frenulum actually go across the gum, you have a really big gap in between the upper the frontal incisor, which is not going to look good. And it's not only because of the cosmetic issue, but then because our mouth, the oral cavity, is actually quite a small space. So that when there's literally something which is going to be on the very right-hand side over here, you have quite a big gap over there, meaning that you will have less space at the back for your adult teeth to come in, and which is going to be contributing to crowded teeth, and you'll have to get maybe expander later, causing a lot of more dental problems. So going back to the first picture over here, as you can see that this person is not closing her lips very properly, very naturally. You can see there's quite a lot of tension on the upper lip here, meaning that she is really pressing down her upper lip in order to close the lips. And then the second one here, we also saw something similar from Dr. Irene sharing before. This is basically the lip frenulum is pulling the upper lip up, meaning that it is quite impossible for this person to close his lips. So when this happens, I would usually suggest my patients to go get the lip tie cut. Okay, tongue tie, what is it? Historically, there are so many myths about tongue tie, especially in the Chinese culture. So there are sayings that tongue tie equals lazy tongue. equals, ooh, your tongue is so fat, there's a fat tongue, and ooh, your speech is so slurry, so unclear, then you must have the tongue tie. Answer is no, not necessarily, because when there is a tongue tie, that means that your tongue function is actually restricted physically. And whenever you see a fat tongue, very likely they don't have an actual tongue tie. They don't actually have a physical restriction, but more likely they have the tongue muscle weakness on their tongue. So that's why it looks very fat. And when somebody has slurry speech, it could be because of the tongue tie, but at the same time that I have seen many people with the tongue tie, but their speech is actually very clear. So there's still no a very clear cut between, because is it tongue tie equals slurry speech or slurry speech equals tongue tie? And then when we talk about the tongue frenulum, in Chinese, the 脷根, and a lot of questions that I would get is that, is this the same thing equals to 根 in 脷根? So is the same as the ligament and tendon? Again, no. The frenulum, I'll put it in a much simpler format term. It's basically a fold of skin, but from Dr. Irene sharing before, we know that it's not only the skin, but it includes also the fascia and everything under that. But if we get that cut, very likely it's not going to affect the muscle movement because we can train that. However, if the ligament or the tendon, whenever it got cut, we will have quite serious muscle movement damage over there. So two things are not the same. And what is actually glossia? And again, Dr. Irene has talked about this. And then there's the connective tissue. What I like to explain to my patients is that a little skin thing underneath the tongue that's been too short, too thick, too stiff. The position, the location is wrong, or is causing restriction so that the range of tongue movement is limited. And when does a tongue tie need to be cut? I'm going to talk about it, like what people from different cultural background would think about it. From my learning by book, all ties should be cut because tongue tie, for most of the professionals, we would know that the base of our tongue is actually located in our neck, underneath the neck. Yes, underneath the neck muscles. So when that is tight, meaning that when there's restrictions, it's gonna cause a lot of tension, not only in the tongue, not only in the neck, but also the shoulders. Whenever the neck and the shoulders are very tense, it could cause a lot of other health issues as well, meaning that could have a lot of back pain and also the headache, and also it could cause the breathing issues, sleep apnea, everything. So by book, all ties should be cut. But I do understand that from different cultures' point of view. For example, in a Chinese culture, generally, we do try to avoid any sort of cutting because it affects the qi, 會影響我哋個氣啊，個氣場啊 and also will affect the spirit. And I have heard about there even a time that we are not supposed to cut our fingernails as well because it's going to be cutting away part of our spirit. 有個生魂唔見咗7、8嗰啲咁樣啦。So, and there's a belief that I know nothing about Chinese medicine. The base of the tongue is the beginning of part of the Chinese meridian system, 啲經絡嘅個開頭. So there's a lot of reasons why in Chinese culture we don't want anything cut. And in the Western culture, there are still a lot of worries about the side effects of the anesthesia, which I still understand because even though that now the anesthesia has become so much more advanced than before, and the side effects is really minimal, but I still understand that a lot of families will still have the kind of concern. So how do mostly I balance it out when I make my decision or recommendations that whether I would suggest my patients to cut the tongue tie or not to cut it? Okay, so basically I would be looking at the tongue in three different areas. One is the physical appearance. The other one is going to be the functionality, which I will be talking about a bit later, and also the health issues that you're currently experiencing. So this is actually something that's going to be very easy for you as a professional or even as a parent to do it at home. Really something easy. So for example, it's actually for both children and for adults as well. So number one would be try to stick your tongue out and try to look at the tongue tip. Is it the pointy tip? If not, if your answer is no, is it kind of like heart-shaped, or does it look short, or does it even look like a spade? And also, we're going to look at the range of the lingual to tongue movement. For example, you have to open your mouth the widest and then move your tongue upward inside the mouth, not outside, inside your mouth, and then see whether your tongue tips is almost reaching the level of the upper teeth, or even beyond that. When your tongue tips reaching the upper teeth, I'll say that the range is like 80% or even more. If not, then likely it's less than 80%. And then when you turn your tongue the sideways laterally, can you push your cheek out with your tongue? And then when you keep your mouth the widest, can you turn your tongue and use the tongue tip to reach the very last molar? So the left up-hand corner, right up-hand corner especially, and the lower left-hand corner and right left-hand corner. Do you pay attention that for children, we don't have the last two molars, we don't have the premolars. So that will be, we will need the children to be able to touch that very last tooth over there. But if your answer is no, and then you have to make your mouth a bit smaller in order to do that, maybe your tongue, there's some sort of restrictions over there. And then again, when you keep your mouth open, and then when you try to roll your tongue backward, so your tongue tip is like basically touching the palate, and then try to trace the palate to the back closest to your throat. Can you feel there is a place, a spot that is a bit softer, almost like a muscle kind of softness? So that place, we call this a soft palate. If your answer is no, that means you are not reaching that. And then also, we definitely have to look at the tongue frenulum, or in some cases, we would call that the tongue frenulum, the length, the thickness, and I like to describe it to my patients that the tongue frenulum is like a line with the upper end and the lower end. Is the upper end like at the middle of the tongue when your tongue is flipped up? Or if your answer is no, how close is it to the tongue tip? And your lower end, is it at the base of the tongue? If your answer is no, is it closer to your gum, or how close is it to the gum, or is it actually located at the gum? And I have 2 stars over there, right over, where's my arrow? My arrow is here. Okay, so here are the 2 stars. So if your answers are more like no to the first part of the questions, then likely there's a higher chance for you to have a tongue tie or some sort of lingual restrictions. So the one here, the picture on the left side, Dr. Irene has shared that already. So this is 80% or beyond more. This one, actually, I would think that's almost like 70% or so. That is what I like to describe as borderline. And these two, the left, at the bottom, the left one and the right one, I would say the range is definitely not enough. So in these 2 cases, I'll really do my assessment even more carefully to assess their functions. But very likely, I would suggest them to go get a phrenectomy. And on the right-hand side is actually my 2 doggies. I like to share these 2 pictures because very easily you can definitely see the difference. If I ask these questions like which one, my black dog or the brown dog, which one do you think has a tongue tie? Very easy, just look at the tip. My black dog over here has a heart-shaped tongue tip over here when her tongue is stuck out. So this one has a tongue tie. Versus on the right-hand side, you can see the tongue is actually quite pointy. So my right dog, the dog on my right-hand side here, the brown dog doesn't have a tongue tie. So just for your reference. Okay, in terms of talking about the functionality of the tongue, because most of the time that, to be honest with you, out of 10 people, I also like to explain this to my patients. Out of 10 people, maybe only 2 to 3 have what I like to call the ideal tongue. Everything is perfect. There's no tongue tie at all. But even myself, it's not that kind of case. So that's why I always do look at their functions and see how much the tongue tie is affecting their functions. Again, this is something easy that you can kind of like think about it yourself, or look at your child and see how the functions is going. So the first one, like when you are clicking your tongue, as in when you're not talking, not speaking, not eating or anything, when you're keeping your mouth closed, that means at rest. And also when you're swallowing, doesn't matter what you're swallowing, even just swallowing your own saliva, is your tongue being flat on top at the palate. By flat, it is not curled up. So your tongue tip has to be at what I like to call the bumpy part, like which is a little bumpy part place right behind your upper frontal incisor, frontal teeth. There's a little bumpy part over there. Your tip has to be landing over there with the tongue body being flat and touching the top, the roof of your mouth. So now I see myself like that. Like that. If not, that means that your tongue is not at the right place. And then speaking of speech sounds, that when we are speaking the T, D, L, and N sound, whether your tongue tips is elevated, meaning is pointing up, not touching the teeth, but again, pointing, touching the bumpy part right behind the upper frontal teeth. If your answer is no, is it pointing down, or even if it is protruded, sticking out? And also when you're saying the S and Z sound, and also the sh and the ch sound, is your tongue inside and the sound is being solid, as in s and z, like that? Or if your answer is no, whether is it like your tongue is sticking out like or like like that? And by areas, laboratory sounds is more like, for example, the S. And the Z sound is like y. I can't quite produce that kind of sound, but it's like y or which is kind of hard for me. But yeah, when your tongue is restricted, when you have a tongue tie, that kind of sound quality that might be happening. And then when you're chewing the food, are you chewing on the left side and right side at the same time at the molars? So when we eat, we will take a bite at the front. And then we'll move the food to the back at the molars, and that's where we're gonna do the mastication, chewing. And then we should be using the right side and the left side at the same time, like chewing very stably with the tongue staying inside. But if your answer is no, and try to think about or try to observe your child and see if they're actually chewing at the front teeth, like. And the result of that is that you're gonna have very short frontal teeth, just like the picture over here. That is because it could be because of the teeth grinding, but at the same time, that it could be because they're chewing at the wrong place. So because of all the wearing, you will see the frontal teeth is actually very short. And then another example would be when the child is chewing. Is it that you'll see the food like shifting to left and right and left and right and left and right all the time? It's like flipping here and here. You can see the tongue basically like flipping all the time. If that is the case, that means that they are not using their tongue to stabilize the food at the back to form very nice bolus, but they have to keep on moving the tongue because of the tie or because of the tongue restrictions. And chewing, swallowing, are you or is your child able to chew and swallow just fine? Because I do get a lot of cases where the parent or the child himself or herself would be complaining about chewing red meat or more leafy kind of vegetables. It's so difficult to chew it for me. I don't like that. So at the end that they're going to spit it out after they chew, or they may not chew enough, they will just spit it out. And later on, they may even start to avoid that kind of food texture. Or when they chew enough and then finally try to swallow it, because of the tongue restrictions, they cannot really push down the food into the right pipe. So in a sense, that's part of the food is actually going to be staying in the throat, and then that's causing the choking or easily get like that, because like part of the food is actually being stuck here. That triggered the reflux, the gagging reflux, and also like choking because our body naturally wants to get the food out immediately. And then also when we're speaking or when your child is speaking, are you having producing appropriate tongue movement, or is your foot like just moving at the right place at the right time and not moving too much or too little? I have seen many patients in my clinic or in my cases that the jaw is moving excessively and the tongue is almost not moving, as in they are speaking like that. Like how I'm talking right now is that my tongue is not moving, but then you will see that my tongue is moving so much because I'm not moving my tongue. Well, I can move my tongue, but in the cases that where there's a tongue tie or tongue restrictions, it's not easy for them to flip the tongue up and down and move it in a fast enough manner to produce all the sounds. So they have to use the jaw to compensate a lot. Or in a lot of cases, in some cases, that they are keeping their mouth so small because the tongue is not able to move up and down too much. So in the sense that they have to keep the mouth smaller so that the tongue can move a bit faster and also in order to create the sounds. Okay, and is the connected speech clear? Connected speech meaning that in sentences, in conversation, not only one word or two words, or is it rather unclear? And in terms of the sleep quality, can the child or can you sleep through the night or wakes up a lot and have a lot of night terror? How's the breathing? Is it quiet, like you won't notice the person is actually breathing? Or versus there are lots of snoring and then a lot of like quite loud breathing sounds. Is a child rolling in bed a lot? Or not rolling at all. We actually do not want the child to be rolling in bed a lot. Once in a while, flipping left side, right side, that's okay. But then when you want to describe your child, do roll in bed and do a lot of kicking, that is not normal. And then we don't want to see any teeth grinding because teeth grinding is actually an indication that the child or the person is not sleeping and breathing properly. So that it is causing some kind of tension in the body, or the body is actually trying to do something, try to remove whatever that is being stuck in your throat by some sort of movement. So again, when you look at my 2 stars over here, if your answer says like most of the answers in the quote, that means that there's a higher chance for you to have a tongue tie or lingual restrictions. So yeah. Okay, health problems. Because of the limited tongue mobility, the motility and position because of the tie or because of the restrictions. And I'm going to divide it into 2 stages. So one is the infancy, the other one is toddler and the older children. When the baby is an infant, so in infancy, that could be feeding issues, meaning that just like what Dr. Irene has shared already, it would be very difficult for the baby to latch. And in a sense that the baby will be eating less or really taking a long time for the baby to latch. That means that it is going to cause a lot of pain in mommy. And then there are actually a lot of research showing that when the mommy is not able to latch properly, it could create depression in mommy, feeling very guilty. And then the bonding between the mom and the baby is going to be much weaker. So the mommy basically will think that it's my problem that my baby is not eating properly. So there's still going to be a way to feed the baby. So we will have to rely on the milk. Sorry for my typo. Should be milk bottle, not milk bottle. When that happens long enough, it could create a bottle addition, which is going to be not a good thing because the nipple of a bottle is a really big foreign object, keep on pressing down the tongue. So it could, if there is no tongue tie, it could create a low muscle tone in the tongue because the tongue is always staying downward. And then the extended use of bottle is also going to affect the dental structure as well. And then because just like what I have shared already, when the tongue, there's a restrictions, when there's a tie, the baby is not going to swallow properly. So even just by eating milk, very likely they're going to be choked, they will be choking. And because of all the eating problem, there's going to be malnutrition. So the baby is not going to gain weight. Sooner or later, the baby is going to lose interest in eating because of all the discomfort. And then because of all this, there's going to be a delay in introducing solid food, which is going to be affecting the jaw development because we will need the baby to start eating solid food to learn how to chew so that we can actually give some training to the jaw to help the jaw to develop for the teeth to come in, or even for later for the adult teeth to come in. And then there will be speech and language delay, because the baby won't be able to move the tongue properly. So then the chances for them to try to say different sounds or even try to learn and imitate adult speaking, it's gonna be very limited or not. The chance is gonna be low. And then of course there's gonna be sleep problem. I have heard parents complaining about the baby snores so loud, and also even not snoring, but then the breathing sound is also so loud, and the baby wakes up a lot. And all these are actually symptoms of sleep apnea. And at the end, to conclude that, likely when the baby has a tongue tie, you will have a cry baby who is very difficult to soothe. And when it's toddler to childhood, again, same thing, same reason. When the tongue is not able to move, again, sleep problems, same thing, snore, heavy breathing, teeth grinding, frequent rolling in bed, wake up in the middle of the night. So you'll see a child going into daddy's, mommy's room all the time. And then it could cause headache, neck and shoulder pain, this kind of thing, because of the tension in the neck, and the neck is causing the back pain, also causing the headache as well. I don't have much time, but let me talk about this very quickly. I had a patient came in. He was almost a teenager already, 12 years old, and then so it was the first time that he came to see a speech therapist or orofacial myofunctional therapist. The moment that he opened his mouth, immediately I told them, okay, no, you need to go get a phrenectomy. So that we had a follow up after the phrenectomy, and I asked him about how he felt. The first thing that came out from his mouth is that, I feel so much better. Like all the tension in my neck and my shoulder and my back is gone. So now that's something that tells us that there is actually a real relationship between the tongue tie and also all other, it seemed to be like muscle problem, but actually also related to the tongue tie, neck and shoulder and back and headache, all kinds of problem. And then because of the incorrect lingual placement in resting, speaking, chewing, it's gonna cause high and narrow palate, crowded teeth. So just like here. And to talk about it very quickly, because the palate is consisted of two triangular bones here, and then there is a little gap right over here. So then when the tongue is not staying on top, and on the outside, that's our faces, the facial muscles. The facial muscles that when we are talking, we are chewing, it will create some kind of force, keep on pushing inward. So when the tongue is not in here, to resist the force from the outside, it's gonna be narrow like that, okay? And then when there's a tongue tie, of course, there's gonna be slow and weak mastication, just like the baby, and it's gonna be taking a really long time to chew and very difficult to swallow, causing a lot of gagging and choking. And then mommy and daddy is gonna complain that he's not very interested in eating. There are a lot of things that they won't eat. There are a lot of, they will only like prefer softer food like rice and noodles, fish. When you listen to that, when you're listening to this, it's almost like the old people diet. And I would be strict to tell them that, look, your child is only like 4 or 5 years old. You definitely don't want them to be eating old people diet. So that's something that we have to take it very seriously. Because of not chewing enough, it would create the jaw underdevelopment, and then which is gonna be like this. So here, when you look at the jawline here on the left side, it's very weak. You don't see any jawbone here. But when you chew it enough, you will see the jawbone over here, meaning that the development is much better here, meaning that the jaw, inside the jaw, the space is going to be much more for the adult teeth to come in. And then, of course, that because when the child is not chewing enough, and if they just swallow the food without enough mastication, it's going to cause stomach problem and it's going to cause fecal problem. So I do like to ask the parents that, how is the poo-poo of your child? Is it like very hard? Is it like he doesn't like to do it? And most of the times that I would get the feedback from the parents like, yeah, his or her poo-poo is like always hard, and it's always causing so much pain. And that is because the child is not chewing enough. Might or might not related to tongue tie, but tongue tie can definitely cause not enough chewing before the swallow and causing all other kinds of health problems. And also unclear speech impediment that I have already talked about, that when the tongue is tied, is restricted. That means that the tongue is not able to move fast enough to support the speech. That will be when we are speaking, especially in connected speech in our daily conversations, you will hear that the speech, the words coming out is very not clear. So, again, to answer the questions, when there's a tongue tie, whether to cut it or not to cut it. So think about like what I have shared so far when we look at when we look at the physical appearance, and also when we look at the functionality, and also the signs and symptoms of the mentioned health problem. What I've talked about, if you can definitely see some physical restrictions there, and then in terms of function, it's also not so good. And if you're also experiencing some sort of health problems that I've just talked about, I think it's actually very, very worthwhile to go for a checkup. And also maybe possibly you could get the tongue tie procedure as well. But whenever you are not very sure, I would say that please go seek an assessment or a consultation for a recommendation. So what kind of professional I would suggest you to go see? ENT doctor, or a dental surgeon who knows this kind of field. Maybe not all speech therapists, but then some speech therapists who is also at the same time trained in oromotor myofunctional therapy. They will be able to give you very good recommendations. So some simple lingual exercises, even if you are going to schedule the procedure, this is for before and after. Or even if you just want your tongue to become stronger, this is also some exercises that's very good to do. So for example, the first one, tongue clicking. 1 to 2 minutes. Be sure that the tongue tip has to be staying to the top, and the tongue has to be being sucked up like that, but not only, but more like. Okay, keep your mouth wide open. The wider it is, the better it is. And then elevate the tongue tip. Try to touch the palate and move it back and forth along the palate for 1 minute. So it's like. But make sure that you are not moving the jaw. I've seen a lot of people doing that. The tongue is fixed, but like that. The tongue is not moving, but the jaw is doing all the work. Not like that. Jaw fixed, tongue movement. And the third one is keep your mouth open wide. Elevate the tongue tip. Use it like a pencil. Okay, so write the letter from A. Do you see? Be sure that the tongue is not gonna fly out, but more like. The whole letter has to be on top at the palate. And then the other one, keep your mouth opening wide and then try to touch your 4 last molars. So the upper left one, upper right one, the lower left one, and lower right one. Try to do that 10 times, okay? So these are going to be very good exercises for you or to get your tongue stronger. And also it's going to give your tongue a lot of stretching before and after the procedure. So thank you.
好，咁咧非常之多謝Irene 同埋 Goldie。哇！我發覺 speech therapy 都幾難 train。
唔係3言2語做得到嘅嘢。
好在我哋個鏡頭睇到頭先你做咩。
好彩我都見到，咦有個鏡頭可以做下嘢。
咁咧，不如我想頭先有啲 video 播唔到，我想Irene 可唔可以再講翻一次啦？我哋而家去翻呢度先啊。我而家播翻呢一個先。呢個係咩嚟㗎？或者講嘛？
睇下先。呢個其實 Goldie 幫佢做緊一個即係啲 pre-phrenectomy 嘅 exercise。
係啊，呢個我可以講啊。呢個就係呢個小朋友啦，就因為一啲佢要做一個 pre-phrenectomy 嘅 exercise。Well, maybe I talk about it in English because I know some English-speaking parent will be watching this. So the reason why this is actually I'm asking the child to do a lot of tongue clicking. Try to through the tongue clicking to stretch the tongue base a bit more. And then the reason why I would use a chopstick and ask her to bite on it is because without a chopstick, she's using her jaw to compensate a lot. Meaning that she'll be using her jaw but not exactly sucking her tongue up. So to prevent that from happening, that's why I use a chopstick to limit her jaw movement, but let her to focus more on the tongue movement.
咁咧，我俾第二個睇下。可 可唔可以講一講呢個？
有冇聲㗎呢個？
冇聲。呢個都係 pre 嘅頭先嗰個。
I think it's 嗰啲得。
Yeah, I think it's the same thing as the tongue clicking. But yeah, now that probably because she has learned to control her jaw a bit more. So instead of doing, now she is more able to click her tongue. So that's why I'm not using the chopstick anymore.
呢個咧係 pose 嘅，呢個就。好，而家轉過嚟俾你睇。
Okay, this one. What I use obviously is Nutella because all kids like Nutella or sweet stuff. So what I do was I put a little bit of the Nutella on top at the spot, and I'll ask the child to open the mouth as wide as possible and lift the tongue up to lick it. So in that sense, I am training two things. One, the elevation, the tongue elevation. Number two, I'm also stretching the tongue base because the kid will have to open the mouth wide and lift the tongue up. So I'm also training the tongue muscle strength as well.
好，咁我又俾另外一條，頭先喺第四。
This one. I try to put the Nutella at the last 4 molars all the way at the back. So just something to attract the tongue to go to the 4 different corners. Again, to train up the tongue muscle, to give the tongue a better control, and also to increase the range of movement a bit more. So also that can improve the motility of the tongue.
不如睇下呢個。
This one is for stretching the tongue because before the procedure, this child is not able to stick the tongue out. So now again, with the Nutella at her front, I try to get her to stick her tongue out and keep her tongue tip at the Nutella for as long as possible. This could help to stretch the tongue base a bit more, number one. And then as she is keeping her tongue tip at the Nutella, it's going to help her to develop a higher or more tongue control and also the muscle strength, because we do have to have strong enough tongue muscle strength in order to keep it straight and out.
好，咁咧就我哋網上有條題目啊 ，Irene，咁佢就話即係 Thank you for classifying the abnormalities. With infants, tongue tie can be released easily in the clinic by someone who has trained in this. However, what about the older children? 大啲點算咧？嗰啲可能要 GA 啊。
Yeah, for the older children, in my clinic 咧就 actually over 12 months 嘅 toddler 啦，from toddler on 我會做 MEC sedation。Under sedation 做 because I like to put sutures in， 係啦，咁 sutures when I put sutures in 咁就會少啲 reattachment。If they're not able to do the exercises well or therapy well, it prevents a little bit of reattachment. Yeah, so I do it under MEC sedation with laser. Yes, there's a course with the anesthesiologist. Ballpark. Usually under 2萬 for lip tie, tongue tie, yeah.
咁跟住就要 Myofunctional Goldie 呢個。
For the training course before and after, I charge the same. I know different therapists will be charging differently. For me, it'll be about like 16,000 per. Is it 1,000? Yeah, per session. And but I do emphasize a lot on the parent and also the kid will have to do a lot of following up at home, because if you just come in for my session 45 minutes per session, and then if you're just gonna do that 45 minutes for the whole week until I see you again next time or after 2 weeks, it's not gonna be helpful at all. So I do emphasize a lot on please go home and do the home practices at home as much as possible.
好似學琴咁啊，
好似學琴咁啊，係啊，
要練一練先，
係啊，或者好似做一樣運動咁咯，because it's all about muscle memory。你要 即係做得夠 ，you have to do enough to develop the muscle memory。如果唔係下都要人提你嘅時候，咁其實冇用咯。
嗱，而家都睇到其實好多個 situation 或者好多個切入。
Oh, sorry, my bad. It's not 1,000. It's actually 1,400. So that's 1,400, not 1,000. Sorry, not that expensive. No.
嗱，其實好多個 intervention point 我哋都要留意啊。第一個咧，好多時而家即係啲10年8年咧，就見到好多啲 lactation consultant 咧，就會即係同我哋講，喂，呢個小朋友個 latching 可能有啲問題喎。咁係咪 tongue tie 啊，甚至 refer surgeon 啊咁樣。咁好少去到你嗰度先嘅係咪？阿 Irene 啊，即係通常都係去咗即係佢哋嘅 pathway 係點樣樣㗎？
如果係 BB 發現嘅話咧 then lactation consultant 就會睇咗先。但係咧，其實tongue tie 嘅小朋友 they may not hit all the problems， 即係佢未必有 feeding 即係breastfeeding issue 㗎。其實可能係一去就去咗可能食 solid 有啲比較 picky eater。咁跟住我就會 refer 俾佢哋呢啲咁樣去 assess 啲 function 咯。但係有啲食嘢又好好喎，但係咧點知唞氣又唔得個，壓住個 airway。咁所以好多唔同 issue，they may not display all the issues。咁睇下 at what point 我哋會 catch 到佢咯。但係有啲就係冇一啲問題都冇㗎。咁即係 I can identify structure， 但係其實佢又食嘢好好啊，唞氣好好啊。冇問題，咁咪唔使整咯。
所以我估你嗱，我哋今日呢條片咧就我諗係好多人都要睇嘅。即係好多個specialties 嘅。頭先 lactation consultant 佢哋要識啦。其實我哋做 newborn 嘅同事，即係做 screening 可能要識啦。咁跟住你做 respire 嗰啲sleep apnea 啊嗰啲又要睇啦 ，ENT 又要睇啦。其實我估都重要。我記得我上次同你講話，其實我哋真係要有一個 system。去點樣 assess 條脷同埋個 lip
係啊
我估今日即係你呢條片呢個 talk 咧就正話到俾我哋聽。咁就頭先我睇下 Goldie 個 talk 咧，其實我覺得哇真係我諗你要練咗好耐。我覺得你講嘅同我哋講嘢好唔同。你講嘢好清楚。
係啊，佢講嘢真係好清楚。
我諗我翻去咧，你嗰個練習我哋做一做先。
應該可能平日同細路仔一齊練習。
咁即係Irene 同 Goldie， 其實你哋即係都做咗好耐下啦。咁你覺得個 trend 係點樣樣？係多啲 awareness， 多啲 refer 俾你哋啊，定係都係好 late 咁樣 refer 俾你哋？
我發覺喺呢1-2年可能越嚟越多 awareness 係啊，咁出邊好多 conference 都會講呢啲咧，依家係啊，所以多上 awareness，even parents 嘅 awareness 都高咗嘅。
佢哋而家識得自己上網揾資料，好多時嚟到我度已經同我講話，我都上網做過啲嘢，揾過啲資料咁樣樣。咁good and bad 啦，當然就係 good 嘅就係起碼佢哋已經有 some sort of foundation， 知道我哋發生緊咩事。bad 嘅就係有陣時喺網上面，因為好多啲唔同嘅 information 噶嘛，好多啲有啱嘅，當然都好多錯嘅。咁變咗有陣時就要花多少少時間去 explain to them 乜嘢係 what is true，what is real，what is not real 咁樣咯。
咁所以我諗今日呢個 talk 好重要。頭先你都講，其實真係五花八門，乜都有人講啊。所以即係我都唔係幾好意思，因為咁多同事同我講過你揾人講下呢個 tongue tie，其實我係唔係好夠膽，我都唔知揾邊個，我都唔知邊啲係啱，邊啲唔啱。咁咧，起碼我哋今次咧就聽一個好 comprehensive 嘅 talk 喺度。咁咧就嗱有幾樣嘢我要講嘅。第一樣嘢咧，今日好抱歉咧，就個 YouTube 咧就其實我今朝翻嚟睇到嘅。今朝我 reset 咗好多次我 internet 嗰度，咁咧都唔係幾 work。咁咧就所以就冇辦法放棄咗呢個 YouTube 啦。咁因為再翻場整咧，佢又會有啲新嘅 link 咁樣，咁都冇時間搞佢。咁同埋咧就第二就好抱歉咧，就係Irene 嗰啲video 咧，就有啲 show 到啲 show 唔到。我成日覺得呢個係應該係 Windows 同 Mac 個問題嚇，我未研究，我未研究。雖然大家都係 MP4 嚟嘅，咁咧就我哋再研究下。咁咧，但係我可以翻去整嘅喺個 YouTube。upload 上一條片咧，我哋可以再整，好似我頭先咁樣，因為我見到你show 唔到你好失望，所以我就你一路講， 路咁要 download 翻出嚟。
係啊，嗰啲 video it just shows 點樣做呢啲 therapy 其實，同埋佢 before after 個 improvement 係真係爭好遠㗎。係啊，咁
咧就我翻去再喺upload 上嗰條片啊，希望會呈現翻出嚟。咁咧就今日好正啊！我諗呢個 talk 咧，我非常之開心。即係我成日都話要還債，呢個債我講咗好耐，而家今日就還Irene 同阿 Goldie 就幫我還咗呢個債，好重要嚇。咁就希望大家都好 understand， 其實而家發覺咧好多嘢都係要好多 discipline 一齊。咁咧就我記得有個議員咁講啊，我睇一個醫生出之後睇4個咁樣，收咁多錢。咁其實大家都明白，近時咧我哋以為我哋自己識晒所有嘢，其實咧好多嘢已經好專門嚇。咁我希望大家都明白，有啲問題咧就係要有人幫手睇。咁呢個平台就希望話會俾大家聽，其實有唔同 discipline 嘅同事咧，有啲唔同嘅 expertise 同埋佢哋有唔同嘅 insight 咁樣樣。咁所以今日非常非常之感激 Irene。咁又多謝 Irene 咧，除咗講書，又帶埋阿 Goldie 嚟啦嚇。就 Goldie 你要再嚟先得，好啊，我要下次要 close up 咁影你講
我要刷靚下牙先啦咁。
你冇同我講要 close up， 好在我望高頭嗰時翻，原來呢度表演緊。咁咧，我台面有2個紀念品，咁就我過唔到嚟啊，因為今日好多嘢呢度。咁咧就係一個電話座，寫住以夷為先。咁咧呢個就係正我哋呢個platform 嘅目標嚇，我哋做咩都係揀係以細路仔行先咁樣樣。